Have you noticed that when you were younger, you could have sex multiple times in one night? Sometimes 2, 3, even 4 times. And now, after one orgasm, your body just seems to shut down. You want to get hard again, but it feels impossible. If that sounds familiar, you are not alone. In fact, this is one of the most common questions I hear from men all over the world. The question goes something like this. Doctor, why can I no longer go multiple rounds in a night like I used to? And how do I fix it? Here is the truth. What you are experiencing has a name. It is called the sexual refractory period. And while it is completely natural, there are powerful ways to influence it, to shorten it, and to improve how your body recovers. In this video, I am going to explain exactly what is happening inside your body, why things change as you age, and I will give you practical science-backed strategies to recover faster, last longer, and bring new energy into your sex life. Stay with me until the end because by the time we finish, you will not only understand what is going on, you will also have a clear roadmap to reclaim stamina, confidence, and vitality. The refractory period is the recovery phase after orgasm, during which it is physiologically impossible, or at least very difficult for a man, to achieve another erection and another orgasm. In women, this period is often so short that they can experience multiple orgasms back to back. In men, it varies dramatically. When you are in your late teens or early 20s, recovery can be minutes, sometimes even seconds. Your testosterone is high, your blood vessels are flexible, your nervous system is firing on all cylinders, you are built to be ready again quickly. But as you move into your 30s, 40s, 50s, and beyond, things begin to change. Testosterone declines gradually by about 1% per year. Blood vessels begin to stiffen, especially if you have high cholesterol, poor diet, smoke, or carry extra weight. Nerve sensitivity can decrease. Recovery systems in general slow down. The result is that the quick turnaround you once enjoyed becomes a much longer wait. For some men, it stretches to half an hour. For others, hours. And for many men past 50, it might only feel possible once per day. But here is the key. A longer recovery does not mean your sex life is over. It simply means your physiology has shifted. And once you understand the mechanics, you can work with it and even improve it. After orgasm, several important changes happen in your body. Prolactin, a hormone linked to sexual satisfaction, spikes sharply. That spike essentially tells your body, we are done for now. Dopamine, the motivation and excitement chemical, drops suddenly. Oxytocin, the bonding hormone, rises, encouraging closeness and cuddling, but suppressing raw sexual desire. Testosterone plays a major role here too. Men with higher testosterone recover faster, while men with lower levels need longer. This is why your recovery can feel so different at different ages. The hormonal roller coaster after ejaculation is what puts you into that refractory phase. The encouraging news is that hormones can be influenced both naturally and with medical support if needed. One of the smartest ways to deal with a long refractory period is not to chase a second round at all, but instead to prolong the first one. There is a little-known method called perineal pressure. The perineum is the space between your scrotum and your anus. It contains a dense tendon-like structure and sensitive nerve pathways. By pressing firmly on this spot with 2 fingers just before the point of no return, you can temporarily block the ejaculatory reflex. Done properly, this can result in what is called a dry orgasm. You experience the contractions and the pleasure, but semen does not expel. Because you have not ejaculated, your erection can often stay strong, and you can continue intimacy without entering the long recovery period. It is not a trick you master overnight, but men who practice it often feel like they have unlocked a new level of control. Now, what if you have already ejaculated? How do you recover faster? First, let us talk about what slows recovery down. Heavy meals immediately after sex divert blood flow to digestion, not to your reproductive system. Alcohol reduces testosterone and restricts blood vessels, lengthening recovery and weakening erection quality. Smoking by constricting blood vessels directly sabotages recovery. So what should you do instead? Focus on deep breathing to flood your blood with oxygen. Slow, steady breaths calm your nervous system and improve circulation. Gentle testicular massage and light circular movements can stimulate blood flow and help with hormonal recovery. But always be gentle as this is a sensitive area. Hydrate because erections depend on good blood volume and dehydration makes recovery sluggish. And above all, allow your body rest. Sometimes the most effective way to be ready again is simply giving yourself time. If you want to see long-term improvements, you need to build a stronger sexual foundation. Think of your penis as an athlete. If you want it to perform well, it needs consistent training, proper fuel, and recovery. Exercise is essential. Cardio keeps blood vessels flexible, and resistance training raises testosterone naturally. Even 30 minutes of movement 5 times per week can transform your sexual stamina. Maintaining a healthy weight is crucial. Excess belly fat converts testosterone into estrogen, which weakens your sexual function. Nutrition matters as well. Foods that boost nitric oxide, like spinach, beets, nuts, dark chocolate, and fatty fish, are your allies. Junk food does the opposite. Sleep is non-negotiable. Most testosterone is produced during deep sleep. So, cutting sleep cuts your hormones. Stress is another big factor. Chronic stress raises cortisol, which lowers testosterone and libido. Tools like meditation, breath work, or yoga are not just for relaxation. They directly support your sex life. Supplements can help too. Compounds like L-citrulline, L-arginine, and zinc support blood flow and hormone health. Research shows that biology can be influenced. In one Oxford study, men given sildenafil, better known as Viagra, reduced their refractory period from an average of 10 minutes to just 2 minutes. That is a dramatic difference. But medication is not something to self-experiment with. It must be supervised by a doctor, as it can be dangerous for men with heart or blood pressure issues. The lesson here is not that every man needs medication, but that recovery time is not purely mental. It is biological, and with proper guidance, it can be adjusted. However, not every solution is physical. Sometimes the reason you struggle to go again has less to do with your body, and more to do with your environment or relationship. If you have been with the same partner for years, desire might feel different than it once did. If you live with young children, stress and interruptions can kill arousal. If your bedroom does not feel private or exciting, your body might not respond as quickly. In these cases, performance is not the real problem. Passion is. The solution is to change things intentionally. Try a new environment, book a hotel room, take a trip, or even use a different space at home. Build anticipation by flirting through text or planning a date night. Have honest conversations with your partner about what excites you both. Sometimes the shortest path to a stronger erection is simply reigniting passion. You can also train your body for better performance. Sexual stamina is like a muscle. It improves with practice. Pelvic floor exercises, often called Kegel, strengthen the muscles that control erections and ejaculation. Edging. The practice of bringing yourself close to climax and then stopping builds endurance and control. Breath control during arousal can delay climax and keep you calm. These habits practiced over time make recovery less of an issue, because your first round becomes more satisfying and much longer. Even if your refractory period does not shorten dramatically, it does not mean your sex life has to decline. You can still deliver incredible intimacy by focusing on the quality of your first round. When you last longer and build deeper connection, your partner is satisfied and you feel confident. To bring this all together, the refractory period is normal, but it lengthens with age. Hormones, blood flow, and nerves all play a role. You can prolong your first round with techniques like perineal pressure. Avoid things that slow recovery like alcohol, heavy meals, or smoking. Build your foundation with exercise, good nutrition, quality sleep, and stress reduction. Remember that medical research shows biology can be influenced, but always under professional care. Do not underestimate the importance of psychology, environment, and novelty in sustaining desire. Train your pelvic floor and practice control to extend pleasure. And finally, remember that quality matters more than quantity. You are not broken. You are adaptable. With the right knowledge and the right tools, you can enjoy a sex life that is passionate, satisfying, and deeply fulfilling at any age. If this video helped you understand your body better, make sure to subscribe for more men's health and intimacy insights. I've put together something special for men just like you. It's called the Men's Vitality Blueprint. Inside, you'll find everything we couldn't fit into one video. Step-by-step meal plans designed to fuel testosterone and blood flow. Joint-friendly workouts that build strength and stamina at any age. A supplement stack that actually works, backed by science, not hype. A 90-day roadmap to rebuild your energy, erections, and confidence. This isn't just a quick fix. It's a complete system to help you reclaim your vitality and live at your best. Men who've gone through it say it feels like turning the clock back 10, even 20 years. The link is in the description below. Check it out after this video and see for yourself the difference it can make. Thank you for watching. I am Dr. Emma Blake, and I will see you in the next lesson.